It's time for Nip Talk.
One of the segments we do every week is Dr. Hermann's Plastic Surgery 411. And you're going to like this one, okay?
Okay.
So actually, I guess 2 weeks ago, I did an interview with Huffington Post, and they were asking me about Botox and trends in Botox. And really, the article got really popular. It hit Huffington Post, and then actually it hit Yahoo. So it probably got seen by a couple million people. And I gave some pretty good answers to them. And so I actually had a lot in the article, which was really fun.
I read it. It was a great article.
Oh, thanks. Yeah. They did a good job. That Anna Rahman, I hope I didn't butcher her name, but Anna Rahman, it's very well written, and it was very actually honored to do it. And so I thought that we would kind of hash some of those things out in the article because they were really good questions and good things. So this is right up your alley. I'm throwing you a softball today. We're going to talk about Botox.
Oh,
so,
perfect.
All right. So for those of you who are not familiar, and I know Botox is very popular, but there are people out there that are not familiar with it. So Botox is basically a medicine that is derived from a toxin produced by a bacteria. And when you inject that into a muscle, it causes paralysis. And we found, and this was actually found 40, 50 years ago, that if you inject that into muscles that cause wrinkles, that will actually prevent those wrinkles from forming. And not only actively, so when I do this and make these wrinkles, if I was Botox, I couldn't do that, but it'll prevent those passive wrinkles from forming that make us look more aged. And so when Botox hit, it was kind of a big deal. And it is approved for 3 sites. And I'm going to have a question for you in a minute, so you get ready. So the FDA approves Botox for 3 sites, as you well know. Forehead, glabella, which is right here, your frown lines, and then the smile lines here, the crow's feet, that you get when you smile. So in my practice, I will only do those 3 areas. Now, there are people out there, injectors like yourself, and and perhaps some doctors that will do it other spots. Now, do you just do the FDA-approved sites, or do you do off-label?
I don't do any off-label.
Not off-label. Okay.
It's just not worth it when you have a degree to throw that license away.
Well, and I will say that it's not crazy. So if you're out there getting Botox off label, I mean, you don't have to be alarmed, but I personally have found for me that it works so good in those 3 areas. I found that in the other areas, in my personal experience, that it doesn't work as good. Like for example, they'll use it in the masseter here to slim the face. I just don't think that works that great. They'll use it for the lip to try to get the lip flip. I've never found those results to be overly pleasing, and to me, honestly, the biggest risk is you paralyze a facial muscle and then you look like you've had a stroke.
Right.
So you haven't had any of those?
I do not. I've had a lot of people come in and ask for
them.
it.
Yeah.
But
I mean, as I said, I don't feel that it's crazy to do it. I just don't want the risk that I have a patient that looks like they had a stroke.
Right.
I mean, because it's not going to harm them. If they get a lip drop or whatever, I mean, they have to wait the 4 or 5 months and it goes away.
And they can't drink out of a straw.
Yeah, I mean, for me, it's just not worth it.
Right.
So you're like that too?
Yes. Absolutely.
I think that's smart, honestly. I mean, you're just avoiding problems. Now, the other thing that there are multiple versions of Botox these days. For the longest time, it was just Botox, and then came Dysport, and then came Jeuveau, and the new one is Xeramin. Now, do you have experience using? Which ones do you use?
I only use Botox.
Okay, same here. Now, I have used Dysport, and I have used Jeuveau. I don't have a problem with them. I like Botox for 2 reasons. One, name recognition. If you say we have Jeuveau or Dysport, some people may not know what that means, right? And the other thing is I just found Botox to be a little bit more predictable. Some of the other ones, they're cheaper, but they don't last as long, so you inject more. So I personally just like to stick with Botox. I don't know. It's not crazy to use the other ones. Have you used any of the other ones too?
I haven't used any of the other ones. I've had really good results with Botox.
I do too. I mean, I hate to be that guy. It's I just use Botox. But I mean, I do like it. It is predictable. And so.
So this is probably going to be a moment for me because I am learning something here at this point. I did not realize Botox was the brand.
Yes.
I did not.
Yeah.
I did not know that.
Yeah, Botox is actually the brand. Now the name is thrown around just like there might be people out there that say I'm going today to get Botox and then they get Dysport.
Exactly.
But the actual toxin is identical. The way that they harvest it and package it might be slightly different, but for all intents and purposes, all those products are very, very close. There are some very subtle differences. I think it's Dysport that comes on like a day earlier than Botox, you know, and like another one maybe doesn't last quite as long. I mean, there's very, very subtle differences, but yes, the Botox is the brand.
I did not know. You've learned me something today.
I did good. Now, hey, Travis, now you getting Botox yet? Have you got the Botox?
I have not gotten the Botox.
Dude.
I did notice that too. That's a great name.
All right, man. Listen,
have
if
not
you ever
gotten
want to get Botox, you better make sure you let me do it. All right?
will
Or you could.
definitely.
Patty could do it. Patty could do it. She's
Okay.
very good.
I got
have
you.
Yeah.
Two great professionals.
I just don't want you to go out into the world and like have like, you know, the foot doctor, you know, give you your
Absolutely.
Botox.
Absolutely.
So I do feel like Botox overall really is one of the absolute best things that you can do to stay youthful. I mean, for me, like some of the things on the face that make people look really aged are those lines here, and I'm starting to get them myself. So I may be your next customer.
Well, you know, I keep having younger and younger girls come in. I have a lot, or people, I should say,
Yes.
in their 20s that are
Right.
coming in, and they understand the effects down the road.
Right, that's so
it's
smart,
amazing.
and that is the really kind of take-home point with Botox is it actually works the best when you start younger. Now, obviously, you don't start it when you're 18 years old, but I find that most people around the age of 30 start to get the wrinkles that will make them look more aged. So my wife, we started her with Botox when she was like 31 or 32 when I started plastic surgery.
She's a freak of nature.
And she
She's
doesn't have a wrinkle,
gorgeous.
right? Yeah, like she has like
Face.
no wrinkles in
Yes.
those areas. And some of it probably is genetic because, you know, her mom,
Yeah.
you know, does look nice, but there's no doubt whatsoever that the Botox is helping her. So
Absolutely.
if people ask me like when you should start, and like I hate those questions where people are ask me, tell me what I need to do, but like,
Right.
but
But
if you
they do
really,
that.
but they do that, and if you pin me down, I would say like around 30 is kind of a good age to start it. So in the United States, there are about 4.5 million, you know, Botox injections a year. So the article did dig into like, you know, how many of those are men, and right now it's about 10 to 15%. You know, it's definitely still dominated by women. And so I will ask you this question: do you have a lot of men getting Botox in your practice?
Yes, we do have men coming in, and what's surprising is I think most people have an idea of what those guys would be like, and they're
Right.
so not
True. It
that
could be
guy.
anybody, yes.
They
I-
are people that are out working in the fields. They
Yep.
are oil guys.
I would
that
agree
are-
with that 100%.
And whether they're trying to get rid of the wrinkles they have,
Yeah.
or being out in the sun
Yeah.
and the wrinkles they're going to get, it's
Right. People are
it's just-
becoming more aware, and there's
Right.
actually been a couple things recently that have really pointed that out. I'm sure you've heard of the Zoom effect, which was basically in 2020 with the pandemic, where all these people who used to go into an office were suddenly on Zoom, and they
Right.
have this picture pulled up of them, and they can see their face.
Right.
So there was actually a big increase in the people seeking out more youthful treatments because of that Zoom effect from the pandemic.
Well, it's odd when you're looking at your face.
Right, yeah, I
you're
know.
just walking around the office and
Right.
you don't
Yeah,
think
exactly
you look
right.
bad, but
And
then
then
when
you-
you're
you see
looking at
yourself
your
on
face,
camera.
you're like, oh.
I know.
that's
It's like
what
when I
look
watch
like.
these videos, I'm doing like, oh my God, I need to go to Patty like
Yes.
right now. But so there was the Zoom effect. TikTok's been another thing. Like as the rise in popularity of TikTok has come on, and people are like filming themselves very close, that also has spawned a bit of an increase
Right.
in things like Botox. But for men, the other thing that kind of comes into play with Botox is ageism, which this used to be something that was really only a problem for women, but in the past, you know, years, decade or so, have become an issue for men. There actually was a big lawsuit against Google by some men who were middle-aged that said that they were discriminated against because they looked older. And so, you know, that was like a big thing, like there was a big lawsuit, that was 2019. And so, you know, because of things like that, there are men out there who now are trying to stay more youthful to kind of keep up with their coworkers.
Right, and it's
So-
so important as we're living
Yeah.
longer and you're in the workforce maybe
Yeah,
longer.
exactly
You
right.
want to look good. You're
You do,
competing
yeah.
with people that are coming right out
Yeah.
of college or maybe have.
So Travis, man, it's time for that Botox. You look good though. I think you're probably a little early, like, but
I'll keep it in mind.
What?
I actually just turned 30 July 7th.
Did you?
So
Oh.
that was my 30th birthday.
well, happy birthday, man.
Yeah.
I will definitely keep it in mind, and I appreciate that. Thank
Yeah.
you so much.
So, and the last thing I would say about like Botox is I do think it's important to research your injector. Now, I know you're good. Like, I mean, you were good before I even started working with you, and then of course I feel like hopefully I helped you a little bit on some of your
you did.
techniques. But not everyone is as skilled as you or I out there, and so I get people in my office, and I'm sure you've seen people as well, who went and had either bad Botox or bad filler. I mean, there is an art to it, and it's something that not everyone's great at, and not everyone maybe does all the work that you do to get as good as they are. So if you're out there, you're thinking about getting Botox or filler, just highly encourage people to research who you're going to, because it does make a difference.
Right.
So.